Hello. Chances are you would not go into a project at work without a plan, or even if you're having a baby, you would want a birth plan. And so is the same with this. And that's why we start with a care plan. Hey, I am Dr. Randy Wirtz, a neurologically focused family and pediatric chiropractor devoted to seeing you get well and keep well. And today we're talking about care plans. Now, care plans do a couple things. First of all, they create certainty with the patient, and certainty with the doctor as well. And then also they give hope. With certainty, there comes hope. They have an understanding that, hey, the doctor might know what they're doing, what happens, and they let you know what to expect along the way too. So we always want to look back to look ahead as far as the care planning. And the general rule that we have when I look at the history of a person who is coming in that is suffering, maybe with colic or headaches if they're a parent, or even like behavioral issues, is we want to look back to see when the problem started. Not necessarily the symptoms, but what caused the problem. And that can be as early as pregnancy for a child, or it can be birth trauma, or when they're a toddler and they fell down the steps or had an accident off the swing, or had a sports injury. Those types of stuff are heavy duty emotional trauma, like post-traumatic stress type trauma. Those are some of the things that we want to look back, and they are red flags when we're looking at the case history. Now, obviously, how long that's been there is going to determine generally what the duration of the care has been, and then also the severity of the issue as well. Hey, if it's a seemingly normal birth, might not be as much as a birth that has an APGAR score, which is a rating of the birth. On the health of the baby when they're born, maybe a 4 or 5, which I've seen those kids too. And it takes more frequency at the beginning of care, more frequency throughout care through their adjustments. So it all comes down to the severity of the problem and how long it's been there will determine what the general care plan is. Now, also what I look for is the types of care that are presented. Do we go with a manual adjustment, or do we go something very easy on that person? Because that will have an effect on what they've been through. If they've been through a very, very traumatic birth as a baby, I go super light on that baby, because the last time someone touched that baby's neck, that was painful. Or the last time there's like an emotional experience, they have this ball of energy up there. Man, you can't let that flood release really right away. And the muscles are really, really, really guarding. And sometimes we have to let that person calm down first. We have to get that nervous system to calm down. So the type of adjustments or the type of care I get is going to be individualized or personalized to that person's needs. So some examples for this. So let's say a person, a young gentleman comes in with suffering from autism. Chances are they might have had a history of birth trauma, colic, meltdowns. First of all, they're not going to hold still very long, so we have to go a little bit quick and a light thrust. So we use a toggle headpiece that does it really, really easy, as opposed to an adult that's just really bogged down with stress. Their muscles aren't moving, they're rigid, and we have to go more of a manual adjustment style with them as well, or a person that's just very, very tense, and we have to do more of what they call a tonal technique, which is a whole system body-wise to calm the whole nervous system before we can get in there to any individual type of nerves that need adjusted as well. So I hope this was helpful for you. I hope this gives certainty, because when you do go to a chiropractor, they should have a personal plan and a personal care with you in mind, and explain what's going to happen along the way. So one, it gives you certainty, it gives you hope, and you know what to expect, so there is no surprises. Hey, I am Dr. Randy Wirtz. If I can be of assistance to you in any way, your child, let me know. I'm here to help. God bless. Have a great day. Bye-bye.